Let me see here. Let me see if that works. So you should see that we are on live. Let's see here. Health Talks. Let me see. Does it show that I'm on live yet?
I don't see it.
Okay.
No, when I click on join event, it takes me to the Zoom meeting again.
Okay, hold on. End live. I'm live right now, I believe. Let's see.
Oh, there you are, live.
Okay, we are live. Let me see. Hey, we are live, huh?
Yeah.
Hey guys, if anyone's on and can see us live, we are testing out this Facebook Live slash. Type in something on the chat box if you guys who are on Facebook Live can see us. And hi Rosie, can you see me? Vivian, hi. Can you see us? Okay, hey, oh, there you go. Barbara's coming on. Hi, Barbara. We are trying out this Facebook Live slash Zoom call with that. Let me
There's like a little delay on it, huh?
Yeah, there's a slight delay. There's usually about a 10-second delay on it. And we can either do like we can share the speaker view, like for example, you're speaking. So we can see you now, Jose, on as the speaker, or we can do it like everyone else can see everybody else.
Right.
Uh,
Oh yeah, I see speaker view.
yeah, speaker's view. So I have you on right now, Jose,
Look at that.
as the speakers, right? So, Jose, what are we doing here today?
So, Dr. Trim, well, first of all, I just want to say thank you for joining us today. You know, everything that's happening with this whole virus, and you know, a lot of doctors' appointments are going virtual now. So it's nice to have one of our doctors help us out and explain to people what to expect on your first virtual doctor's appointment, right? Because it's new to everyone. Some people are a little hesitant. I've been actually doing it for a while with my kids and the pediatricians by sending photos or, you know, doing a video call with our doctors. But a lot of people out there are new to this. So I really appreciate you being on today and helping us out with that, answering questions. And also we have Cindy Mendoza or Santos Mendoza. She's one of our local Medicare brokers that I've been working with for several years now. And so if anybody out there has questions about Medicare, Cindy's going to cover, you know, a brief presentation about Medicare and yeah, like when to apply, if you recently retire or you're thinking of retiring or unfortunately got laid off. So we're definitely can answer any of those questions as well.
Whoa.
Thank you, Jose.
Oh. Hi, Cindy. Glad to see you.
Hi, Dr. Trinh. Thank you so much for joining us today. And thank you, Jose, also for the partnership with Memorial Care.
Yeah, definitely.
So who's the other guy that's hiding that says iPhone on it?
That's your friend.
Hi, good morning, everyone. This is Dr. Hua Win. I'm a good friend with Dr. Trinh, and I do have experience with doing telemedicines and telehealth. So I'm excited to join the meeting today to explore and also to learn from all the experts here.
Very nice. Well, welcome everyone.
How long have you been doing telemedicine, Dr. Hua?
So basically, it's been almost a year or two now. Even before the COVID started, I actually worked for the state. We were the largest telehealth users and provider. So, and then once the COVID hit, I think telehealth kind of boomed and expand. So a lot of new innovation, new technology, a lot of new idea that's that's coming out. So I'm very excited to see what we can come up with Dr. Trinh.
What is for you guys who are on Facebook? Have you done and just type yes or no? I'm curious. Have you done a telemedicine visit with your doctor yet, where you talk to your doctor on the screen as opposed to in person? Have any of you guys done that? Uh, I'm just curious. Hi, Christy, you're on. Christy, have you done telemedicine yet with your doctor or Barbara? I'm since this is all kind of new to many of us here. Prior to coronavirus, we weren't actively doing telemedicine, and now most of us are getting involved in that. What is the benefit of telemedicine, Hua?
So basically, that's as you know already, just have a taste for the last couple months. As my experience, I also did some telemedicine for hospice and other home call program. The benefit is especially for those or lack of resource in terms of getting travel from one place to another. Those who mobility impairments, it deliver as care, much better, good care, as even better care, where they don't have to wait in the room or in a physician office and expose themselves to especially during this time to all these different virus where they can even make their existing condition worse. Where we with telehealth, you can actually reach out through the screen to you and provide as I say, even better care than in the office where we don't have to rush and a patient waiting or one room to another. So I think there's a lot of benefits, especially if you will have established with a primary care physician who know you well. So I think a hybrid model also worked really well as well. So as I said, we'll see what the future will hold for us. But telehealth is here to stay.
There's on our chat group, there's a few folks who have tried telemedicine already. If you guys wanted to join us on Zoom, I just posted in the chat comment our Zoom link. You're welcome to come join us and chat with us directly. But we want to know what some of your experiences are with telemedicine. I know I saw Christy have tried it. Gustav, have you tried telemedicine? Barbara has not. I think one of the benefits that I've noticed with telemedicine lately is that, especially for our patients who are in the Laguna Woods area or the communities where folks are retired, sometimes arranging transportation is a headache to get to your doctor, and often that is a barrier to getting the care you need. So I gave this talk yesterday actually to another group on telemedicine, but telemedicine cuts down the entire barriers that takes you from making the inconvenience of being on the phone, making an appointment, waiting on the phone, to finding a time that is convenient for you and your doctor, and then for many people taking time off work, right? Taking the inconvenience of taking time off work, and then you get to your doctor's office, and then what do? There's more waiting in the waiting room. So there are a series of steps before a patient even gets to their doctor to talk with their doctor, and we've realized that in these many series of steps that leads up to the doctor's office, many of these steps are wasteful, and there's no value in them because there's a lot of waiting time. And there's a lot of time arranging transportation. There's a lot of time just arranging for your kids' childcare if you're at home, or taking time off work. So so to get to a doctor's office sometimes is just, it sucks for the whole process. Telemedicine takes out that entire wasteful um, period of waiting in a waiting room, arranging transportation, getting time off work, and it gets you directly to what's valuable for you is that specific direct interaction with your doctor, your nurse practitioner, your PA, your nurse, your medical team, and it cuts out all the BS that's in between. Often is what I'm noticing with telemedicine. Um, yeah, I wanted to see if you guys have any thoughts on this. Type in the comment box. What are your thoughts about telemedicine? And if you're interested in trying out telemedicine, Christy says lean. That's correct. It is lean. Good morning, Catherine. Catherine just came on. We're chatting about telemedicine here. Memorial Care, is Memorial Care doing telemedicine, Jose?
Yeah, so yeah, very exciting. It's obviously somewhat new to us too, but a majority of our physicians are all doing telemedicine. And it's funny, in the beginning, a few of our providers were a little hesitant, but now, I mean, they're loving it, some of them are working from home, some are working from their office and doing both telehealth and seeing patients at their offices. But yeah, I mean, a lot of great feedback, not only from our members, but also from our providers. Another thing that Memorial Care started doing, we're doing our virtual urgent care visits now.
Ooh, what is
Yeah.
that? Tell us about that.
Well, I'm not so sure what exactly. How do you? Because and that's the thing, is that we some of those appointments. I don't know exactly what when somebody will join that urgent care versus just doing a very normal telehealth with the doctor at a doctor's office.
Right.
But I'll get a little more information and
I think
from one of our urgent care doctors.
Yeah, I think the urgent care is like it's like I just want to see somebody now. It doesn't matter who it is,
Right.
right? And then and so you get, it's not necessarily a scheduled visit. It's like Uber doc, right? I need an Uber and I need now, right? Somebody come pick me up, no matter who the driver is, right?
No matter who
So
it is, yeah.
so I'm envisioning urgent care is the same. It's like I need to see a doctor now because it's urgent, and
Right.
And I think
That could be it, yeah.
that's usually what an urgent care would be for. Whereas your primary care doctor, you can do telehealth, but you have to schedule an appointment.
Yeah, exactly. You have to schedule an appointment, yeah.
So,
Yes.
Dr. Trent, one of the questions that I often get from my clients are during this pandemic, and especially, of course, with the retiree population being at higher risk, how can they determine whether telehealth is the best avenue or trying to make a same-day appointment with their primary care physician? Can you give us maybe some thoughts on that?
Right. So not every visit is appropriate for telehealth, right? For example, if I wanted a physical exam, you can't do that to telehealth, right? So that requires an in-person visit. But most visits, if you wanted to, let's say, get a referral to a specialist, or if you just wanted a medication refill, or perhaps you wanted to review your lab results, right? Not every visit with a doctor requires a stethoscope on you, where not every visit requires a doctor to examine you physically. Those are the visits that are most appropriate for telehealth. And I've been speaking to my docs at Memorial Care who are doing telehealth right now, telemedicine, and I was surprised. I asked them, what percentage of your visits on telemedicine are you able to make a complete diagnosis and a treatment plan without having to bring the patient into the office? And the answer I've been getting which actually surprised me as well, is around 80%. My docs are telling me 8 out of 10 times they can do an entire visit, make a diagnosis, prescribe a medication, put in a referral, put in a lab request, and they can do everything 8 out of 10 times on a screen with a patient, at a video screen, without having to have that patient physically walk in. And I was pleasantly surprised, because I first thought maybe half out, 50% or so, but it seems like we can make a lot of our treatment plans and diagnosis simply from talking with a patient, right? And getting a history out of the patient. And I guess if you got a wart or something, maybe you can show it on the screen, right? Okay, what do you think of this wart, right? Hemorrhoids would not work in this way, right? But other warts will work, right? Other things will work. So most of the time you can get an actual full visit through telemedicine and stay at home without running around worrying about coronavirus or worrying about protests and riots and the dangers that are kind of out there today, right? You can get your healthcare taken care of simply from your safety, from being at home. And guess what? You don't have to arrange transportation if you don't drive. You don't have to take time off work. You don't have to arrange for babysitting, and you don't have to wait in a waiting room. And it's crazy.
So what I'm hearing
Mhm.
is most of the symptomatic kind of appointments, when you're having certain symptoms, you want to know whether there is medication that you need to take, or if you are having, ironically, I had a client of mine that was afraid to go to the ER and called me and said, Cindy, I'm having chest pain. Like, you need to be calling 911 right away. And I think that the some of the fear that seniors are having into, walking into an ER might be, potentially deadly for many of this, retirees that are kind of debating whether or not they go to the ER, debating whether or not they go to urgent care. And I have said it to them that telehealth, in this particular case, when they have a fear, can be a very good tool to have. Now, one of the other things, and I'm hoping maybe Jose, you can help address this as well, is one of the questions that they ask, depending on which carrier, what specific plan they are on a Medicare Advantage plan or a Medicare supplemental plan, is, well, when I call telehealth, are they going to have my medical history? And so how do we address that? How do we best advise our clients to, as to what resources are available from a carrier, what resources are available from their medical group, and what's the best avenue?
Yeah, so for what we're doing at Memorial Care is, because I know a lot of the health plans, Scan being one of them, I know they offer a 24-hour nurse line as well. And I know as soon as they get all the members' information, and then they send it over to the medical group. And then we add the notes to the members' chart, and one of our doctors will do a follow-up appointment.
Perfect. That's great to know.
Yeah, but we do any telehealth appointments that we do at Memorial Care. We do have the members' information in front of the doctor. They do have that information, and so yeah.
Interesting. Patricia says she has a telehealth follow-up with your doctor. And then she also says, yeah, I mean, for dermatology, they can look at your skin, but they can't treat it. So if you need something zapped off, Patricia, that's an appointment with a doc. And so, cool. Do you guys have any questions about telemedicine? Is there a way people can practice talking to their doctor, or I'm wondering, folks.
Do like a trial run. Right?
Yeah. Good morning, Zach. Zach's online.
Hey, what's up, Zach? Same Zach I know?
Yeah, same Zach you
Hey,
know.
what's up, Zach?
The very cool. So I've started doing telehealth with our brain health consultations. It works really well because again, with these brain health consultations, we don't have to examine our patients because we're talking about their memory loss and things of that sort. There are many different platforms. Memorial Care, I think, uses Zoom Health.
Yep.
Yeah. So that's a good platform. Irvine Clinical Research uses Doxy. That's another platform. There's multiple platforms, all very convenient for telehealth. But Jose, how does a patient, let's say they want to do a telemedicine visit with their doctor in Memorial Care, what do they do to arrange for it?
So, yeah, great question, Dr. Trinh. So there's actually a phone number that our members call into, and then our customer service department will schedule that appointment. Either like what you said earlier, if they need to speak to somebody urgently, I'm assuming they'll transfer to the urgent care, I guess, right?
Right.
Or if they want to have a consultation with their provider, that's something they can do. But yeah, we do have I'll give you the number.
Yeah.
That phone number is
type the number in the chat box. You have the chat box?
Yeah, great idea.
Yeah, for those who want to check out a Memorial Care doctor through telehealth. Jose will type it in the chat box for you guys.
I'll type it in, and I'll also include our website where you can read a little more information of what we're doing with this whole virus thing.
Right. Cindy, do you represent any particular health plan with Medicare, or?
I do. So I'm an independent insurance agent. So I represent many of the carriers that offer Medicare supplemental plans, Medicare prescription drug plans, as well as Medicare Advantage plans. All of them, being top rated. So I don't represent any of the plans that will have less than 4 stars and above. For those that are not familiar with the Medicare rating, CMS, which is the Center for Medicare and Medicaid Services, oversees the carriers that they have a contract with, and they give them a rating. And that rating is representative of the care that they provide to their customers, how quickly they process claims, how quickly their patients are getting referrals. So all of that gives them a rating that is from 1 to 5. And so, I try to stick with the plans have had a long history of being in the market, of having, a 4-star and above. So yeah, I'm licensed in 5 states. I started here in California, and of course, I have many of my clients that started moving out of state. They started moving to Colorado and to Arizona and Nevada and Texas. And so as they have moved to other states, I've gotten licensed there, to be able to continue to service them.
Very cool. So like, what are the questions that you answer for folks who are maybe looking for plans? What are some of the common questions you get?
So I like, very specifically, I have a 5-step approach to Medicare, because I think that when someone comes to me with one specific question about Medicare, is what's top of mind at that moment, right? So we have a live chat on Facebook. We have a live chat on our website, West Compass Insurance Solutions. And some of the times, all that I get is, could you please explain to me what is Part D? How do I get it? And then I understand that when you start to peel the onion a little bit of what Medicare is and how it works, it's always easier to start with the basics, right? It's always easier to start with the ABCs. And that's where I tend to, to focus on a 5-step approach. So step 1 is always the education component, helping them understand, the basics of Medicare, this alphabet of Medicare, right? That always starts with, with the ABC, the Part A of Medicare covering the hospitalization, the Part B which covers all of the other medical services, like the doctor visit to Dr. Trinh, specialty or specialist, blood work. And then the Part D covers your prescription drug plan. There is a Part C that I purposely skip because it typically combines the Part A, the Part B, and the Part D. Very specifically for our Orange County viewers, I try to emphasize that in Orange County, we have one of the most comprehensive Medicare Advantage plans in pretty much, and I dare to say, in the country. When you look at those Part C plans, Medicare Advantage plans, it's a very competitive market because you have pretty much zeros across the board. What do I mean by that? You go see a doctor, your copay is zero. When you see a specialist, your copay is zero. When you get blood work done, copay is zero. So very, comprehensive plans. Once we go through the Medicare education, then we move into the health assessment. And the health assessment is a moment where we're looking at what are those specific health conditions that you as a client or as a patient have that might guide us into finding what is the plan that is best suited for you. So for instance, some plans focus on, more benefits on vision. Some of them have, better dental, coverage. Some of them have lower prescription copays for diabetic patients. So depending on your specific health need, we'll have a better idea of, what plan is best suited for you. Step 3 is, when we do the plan review, right? So we present what are the plans that are going to give you the lowest prescription drug copay, the ones where you can keep your doctor, where you're in a medical group, be able to stay with Memorial Care, so on and so forth. And then after that, we help process the application. So we do all of the paperwork for you. Before we joined on the Facebook Live, Dr. Trinh, Jose and I were talking about Jose helping some of his clients, process the Part B application online. This has been a big ask lately in the industry. Why? Because many retirees are now being in a position where they were not ready. Excuse me. They were not ready to fully retire. They continue to work past 65, and now there's massive layoffs. And they are in a position where they now need to join a Medicare plan, and they have to apply for their Part B. Well, you typically do that at a Social Security office, but the Social Security offices are closed. So what do I do next? That is where we come in and help you process your application online. It usually takes about 5-10 minutes if you know how to process it and where you're doing, and this is exactly where we come in. And then, of course, process the enrollment for the specific carrier and the plan that we choose jointly. And step 5 is you just join our community. And we're very active participants in the community. We like to stay in continuous touch with our clients. And be that primary point of contact. So we have a very close partnership with with the medical groups such as Memorial Care. So Jose and I typically give our cell phone numbers to our clients, and that way when they have questions, whether it is about the plan specifically or about the medical group, they have this one point of contact that they can go to for any questions that they may have.
Awesome. I just remember A, B, C, and D. I'm just sorry.
Yeah.
There you go.
Yeah.
Simple as that.
My memory's
Yeah,
bad.
that's correct. We start with the ABCs and we end with the ABCs. Right?
Very cool. Thank you so much. That was educational because it gets confusing even as physicians. It's like we don't remember all this stuff with Medicare. with that. So thank you.
Yeah, it does get confusing, and I think that the main point that I have made throughout the years is that it really doesn't need to be. It doesn't need to be as confusing. I think it's all about, how you present it. It's about, how you break it down, what of the, what kind of information is really valuable and important, and which one is fluff. And unfortunately, when you are about to turn 65, all that you get is this big booklet from from Medicare that is typically written by lawyers, to help, in quotes, understand how Medicare works. One of the funny things that I find myself is anytime that we have any community meetings, I'll ask, by show of hands, how many have read the Medicare for You booklet? And typically I have maybe one, sometimes two hands that raise, and I looked and I was like, "Are you an engineer, sir?" "Yes, I am."
Yeah. Yep. Yep.
So yeah, so our job is to try to break down the information in a very easy to digest, and and again, to be an ally in their Medicare journey.
How do so if folks have further questions about Medicare, are they able to contact you?
Oh, absolutely, absolutely. I'm going to put my information on the screen right now.
Yeah. Cool.
There we go.
Nice.
Yeah, so I have my information is on the screen again. I'm an independent insurance agent with West Compass Insurance Solutions. And our website is westcompassinsurance.com. There's our 800 number, 877-248-9917. And as I mentioned, we are licensed in 5 states. Love to work with Memorial Care, has been a great partner.
Right.
We're just very thankful to be in this call with you, Dr. Trinh.
Cool. I learned something today. Awesome.
That's great.
Appreciate all your support, my friend.
So we'll be doing this every week, right, Jose? Every Wednesday?
That's correct. So every Wednesday at 9:30.
Very cool. And then we'll learn something new and we'll get the word out.
Yep. So every week will be a different topic. Next week we'll be talking about what steps do I need to take if I have a chronic condition. So that should be an
Ooh.
interesting. Yeah.
Yeah. What steps do I have to take? I don't know, Jose.
You tell. Hey, you got a week to find out, Dr.
I got a week to find out.
Make sure you YouTube and Google
I'll
stuff.
Google the steps you need to take and give you guys an answer by next week.
There you go. There you go. And Dr. Trinh, also, because what we wanted to do is this talks in the morning, we really wanted to focus on, your expertise and you being able to share your insights, with us. For those individuals that want a little more in-depth Medicare information and seminars, we hold a deeper dive on Medicare also on Wednesdays. The times vary between 5 o'clock and 3:30. We've been trying to be flexible for individuals that are at work and those that might want to join a little bit early. And those times can also be found on our website at westcompassinsurance.com, as well as on the Memorial Care website. We have the links to to our afternoon session. So again, Wednesday morning being the health talk, and then Wednesday afternoon giving individuals an opportunity to have a deeper dive.
Awesome. Thank you so much. That's good info to know, Cindy. Awesome.
Thank you.
Cool. What else, Jose? Anything else we're supposed to do today?
That's it. Happy hour.
Hey. How about a Zoom happy hour?
I like that. I like that idea.
Like at 5 p.m. You guys on Facebook, do you want a Zoom happy hour at 5 p.m.? Everyone goes on Zoom or Facebook Live, and your drinks are with you at home, so you don't need a driver.
That's right. And then we'll share different drink recipes.
Drink recipes with a little CBD, right?
There you go, even better.
Yeah.
Oh man.
All right. I guess
Well, thank you.
yeah, we'll be here next Wednesday at 9:30, and we'll
9:30.
talk about
Yep.
chronic disease, guys. So for
right.
you guys on Facebook, meet us here next Wednesday at 9:30, and of course I'll be here Thursday, which is that tomorrow?
That is tomorrow.
That
Yeah.
is tomorrow. Yeah.
Okay, so we're doing our regular health talks without
Health
the
flag.
twin tomorrow. We have Lisa Thurman coming on from Global Alzheimer's platform
Nice.
tomorrow at 8 o'clock. So that'll be a fun one too. Okay, are we
Great.
All right.
set for the day?
That's it, my friend. Well, if anybody wants to join us today at 3:30, our Zoom link, it's on Compass Solutions website and also on memorialcare.org. So if you you want to find out a little more about Medicare and what options you have or a family member, please feel free to join us at 3:30 today.
3:30 day, very cool. All right, well, take care.
All right, my friend.
We're,
Thank
Thank you
you.
so much. Thank you.
All right.
Appreciate it, Dr. Trinh.
Bye,
Thank you
Hua.
today.
Thanks for coming.
Thanks, everyone.
Okay. Thank you, everyone.
See ya.
Thank you.
Bye-bye.
Bye.
Okay. Bye.